Could I have my eyebrow lowered with Botox? I have ptosis on my right eyelid. The left lid is pretty normal, but the eyebrow is a bit higher than the right. If I were to have Botox to lower the left lid, would there be a chance that the left lid would droop? I'm hoping for this result so there would be some symmetry with the droopy lid. I can't afford to have surgery on the droopy lid. Thanks in advance.
Thank you for your question. You state in your question the concern about possibly lowering one eyebrow with Botox. And in the body of your question, you state that you have ptosis in the right eye and that there is asymmetry with the eyebrow on the left eye, and you feel like the eyelid on the left side looks fine. And then you state at the end of the question that you cannot afford to have surgery on the right eye. So you're basically asking, is Botox a good option for you? Well, certainly I can assist you with this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Botox is a very big part of my practice, as is eyelid rejuvenation. So to begin with, I'm going to give you some guidance as to how I evaluate patients like yourself and what role Botox may play in your situation. First, let's begin with some definitions. You describe the right eye as having ptosis, and I think it's because you feel like you can see less of your eye on the right eye compared to the left. But we have to make a distinction between the term ptosis and another term called dermatochalasis. Basically, in our practice, dermatochalasis we describe to our patients as excess skin. In other words, skin that is stretched and is folded over and is in excess over the eyelid. Now, ptosis is a very specific diagnosis, and it has to do with the relationship of the eyelid margin, the part where the eyelashes are, relative to the pupil, or the black part, the center part of the eye. Now, when you say you have ptosis, I think what you probably mean is you have excess skin over the eye, or dermatochalasis, and there's a clear asymmetry. Now, it has been an observation of mine for many years that when people have excess skin over their eyes, whether it is a situation where they have dermatochalasis, ptosis where the eyelid is drooping because of the muscle that lifts the eyelid, or a combination of both, there is a reflexive lifting of the eyebrows. And it's basically something that happens as a response to the progressive downward pressure on the eyelid. Now, in your situation, it's clear that there is that asymmetry and that the left brow can be higher because of just natural asymmetry and also because of just asymmetric muscle tone. Now, one of the things that happens that can go awry when you have Botox in the forehead is that the brows can drop. And when they drop, or even if you just try to drop one brow, you might find yourself in a situation where the left eye now looks a little bit more like the right. That may not be a good thing for you. Another reason why there's an asymmetry has to do with the way the levator muscle, the muscle that lifts the eyelid, has fibers which affect the eyelid crease. And so on the left side it might be still holding, while on the right side it's separated more. Now, I think that certainly Botox could be part of your strategy. There is a procedure called Botox brow lift where the eyebrows are actually elevated on purpose by 1 or 2 millimeters. It's not the same as a surgical brow lift, but you can actually relieve the eyes of having a little bit of extra skin over them. Now, you mentioned that you are concerned about not being able to afford eyelid surgery. And certainly I understand this. You know, a lot of my patients, I treat patients from people who have very modest, low-paying jobs to people who are multimillionaires. And certainly affordability has been one of the things that I really advocated for since the beginning of my practice over 20 years ago. I think you can make a comparison of how much you spend on Botox injections, even at deep discount prices, versus the cost of an actual definitive surgical procedure. In the long term, surgery tends to be a better value, even though there's two different benefits. I never say one replaces the other. So you may want to look at the options. For example, in our practice, to help control costs, we have our own facility within our own offices, and these are facilities that are certified by the Joint Commission, the same certifying body that certifies hospitals. So we maintain very high safety standards, but because of the unique requirements of our practice, we're able to be more efficient in how we allocate personnel compared to hospitals. Hospitals have to have redundancies and a lot more personnel to do very large extensive surgeries to everything to minimal surgeries. And so we're able to help our patients afford quality surgery with the safety of a proper facility. The last thing you ever want to do is save money when it comes to your cosmetic procedure. But with that understanding, I think that you should explore some possible ideas with with Botox being a lifting procedure rather than a dropping procedure. It may actually just take you trying to do this to learn how your eyes would look without that left brow being elevated. In the absence of a physical examination, I think that it is important that you meet with qualified specialists who perform Botox, who perform eyelid surgery, learn about your options. I know affordability is an issue, but investing in your face is very much well worth it in the long run. As a specialist, I perform revision procedures. I perform a lot of, I deal with a lot of complications. And so I can tell you that finding the right doctor to help you in the right path, even if you can't afford it right now, at some point you'll be ready to move forward with probably a more definitive procedure. When I counsel my patients, I always try to just understand from what budget perspective they're coming from. And then I try to relate that with the priorities they have and try to come to a plan that makes the most out of their resources. So I hope that was helpful. I wish you the best of luck, and thank you for your question.